But some decades ago, they set up a tiny clinic to see children, pretty much all boys, all of them very little. And these are the kids who from age 3 or 4 are saying things like, I want to cut my penis off, God made a mistake with me, I'm meant to be a girl, and so on. And it treated them, with sort of what's now called watchful waiting. Just support them, support the families to not get freaked out by this. Just kind of help them to not hate themselves, bring them towards puberty, and then puberty tends to resolve the issues. We know that, we've known that for decades, that if you just support kids who think this when they're very little, puberty works it out for them.
That's the sort of common sense position. Give it some time, a lot of these things work itself out. And yet there's been fierce pushback from the usual suspects, the activists. Fierce pushback. What possesses adult people to take children on that sort of a journey?
So there's two bits to that. One is that in modern medicine, a lot of the time, you're going to get your care from several people. And there's a concept called the chain of trust in medicine, that all the specialists believe all the other specialists are doing their job properly. So if you're an endocrinologist and somebody comes in and they've got the piece of paper from the gender doctor saying, this person has gender dysphoria, which is the fancy word for distress, give them testosterone or give them estrogen, you think they've done their job, and your job is just to check that they don't have some contraindication like, high blood pressure or diabetes or something. So you then give the child hormones, and then the child is referred on for surgery. And that person thinks the chain of trust holds too, and they may remove that child's genitals or a woman's breasts or whatever, because they think other people have done their job. But at the beginning of the chain, the person who says this child has gender dysphoria, they're not cutting anything off or giving any powerful drugs. They're not prescribing or operating. So I think it's that diffuse responsibility. If everybody's responsible, nobody's responsible. Like, nobody did the terrible thing, and yet the child ended up a sterile adult. And that's one part of the answer. But the other part of the answer is these people believed they were doing the right thing. Human beings are very prone to getting an idea in their head and thinking it's so right that it will be a waste of time to check. And the way you check in medicine is you have to do studies that have got control groups, like people you don't give the treatment to, and you compare the two. And doctors are dreadfully prone, historically speaking, to thinking, but I'm sure this is the right treatment. And if I withhold it from the control group, that's very unethical. And we train medical statisticians to understand that it's not unethical, and we give them lots and lots of examples of, in the past, treatments that got rolled out that people just assumed were the right thing, and they thought people looked like they were getting better afterwards, and then finally someone did a rigorous study. And it turns out that they weren't getting better, that it was the placebo effect, or just that this is the sort of thing you get better from over time. And in fact, they'd been harming their patients with this. So they haven't done that because they think they're right. And if I may just say one more thing about why they think they're right. If we go back decades, it wasn't just little boys who turned up at clinics. In fact, they were just a tiny number of those who turned up at clinics. Clinics were basically for adults. It was adult men mostly, some women, but mostly men. Some of those men were gay men who had come to the conclusion that they were just meant to be women, that they were so womanly that they'd be happier if they were women. But some of them were heterosexual men who were fixated on the idea of being a woman for erotic reasons. So these are men who would be erotic cross-dressers, which is a fairly common minority sexual male interest, who had become fixated on it and wanted to live full-time as a woman. And for those men, like, convincing people that what they have is something serious and that must be helped. Like, I don't mock or dislike anybody because they have a fetish or an unusual sexual interest. I don't want to know about it, but I don't think they're bad people. But they feel shame, and a lot of people do shame them about it. So they need a narrative that isn't, I'm an erotic cross-dresser who can't just keep it to the bedroom at weekends anymore. And that narrative is, I was born this way. They got that narrative from the gay rights movement. And I mean, the fact is that a lot of gay people are born that way. We know that's a fact. But this is something different. And so if they're born that way, they need there to be children who are that way. And so those people are the main constituency originally for the idea that there are children who are born in the wrong body, or born actually being girls when they look like they're boys, or that sex can be assigned at birth. And they want that to be true because they want it to be true for themselves, and because that's the narrative they want to present to the world. I don't think it's that cynical, like I'm saying it like they're doing it deliberately. But I think it's a very, very deep-rooted psychological desire to be propped up by those children's stories. And that, to my mind, is how all of this got off the ground, that there are people who desperately want it to be true, clinicians who want to be saviours, and then a diffuse responsibility, which means that nobody takes responsibility. And, Medical scandals are common. They happen really with repeated and tragic frequency. And when we look back at them, we always say, let's learn lessons. But when you look back, there'll be some particularities, like that story about adults wanting the children to be treated this way. But there are just also similarities. Doctors do get a saviour complex. Medicine is complex. People do palm off responsibility on each other. And then finally, people don't want to admit that they've got it wrong because it's too painful. Like, imagine you being the one who did those things. I do know a few of the whistleblower clinicians from the Tavistock, and they're people who practiced in this way before they realised that what they were doing was wrong. And they struggle mightily with it because they know they did some of their patients harm, and that's not what they went into their job for. So for some people who've gone further down that road, they can never admit it. It's too painful to realise what they have done and to admit it to themselves, so they will never change their minds.
Isn't that a great warning to those who are still hell-bent on the affirmation model? Look out. The warning signs are there if you care to look. You need to think very carefully about going down this road.
I think it's the sunk cost thing. You've got into it, you've done this thing, and now you need to find arguments. Human beings are terribly good at rationalising after the fact. You need to find arguments for why you did the right thing. So there's all these talking points. Like, because I spend my life working on this, I know all the talking points by now. And one of them is that regret after transgender surgery is less than regret after surgery on your knee. They'll say it's less than 1%. But I used to work as a statistician. My degree is in maths and stats, and I did a PhD in mathematics, and then I worked for the Royal Statistical Society editing their magazine for some years. So although I wasn't somebody who did statistical studies, I was someone who used to have to explain them and write them up. The first question you should always ask yourself about data is, how do they know? Like, I know, because it doesn't take long to find out, that none of the clinics anywhere in the world are following up their patients. So how could they know what the regret rate is? No, they don't know. And then they put out these studies, and when you look at the studies, first of all, they're just done online. Anyone who wants can fill it in online. So straight away, that's rubbish, because you haven't got any sort of a representative sample. You've got a biased sample. Doesn't matter how large the numbers are in that case. It could be 1 million people. If it's biased, it makes no difference. It's still a bad study. They are excluding, for example, one of the big studies that's often cited, very poor study, to say that there's very little regret, excludes detransitioners. You have to currently identify as trans to be eligible to fill it in. So you're like, you can fill it in as many times as you like. They aren't checking people's names. You can fill it in from abroad. Like, it's absolute garbage. And yet this is the sort of thing they cite. So I would offer this to your listeners as a general point, and not just about this one. Whenever somebody tells you that they know a numerical answer to something, ask, how could they know that? Because sometimes it's clear immediately that they simply can't know it, that there's just no way of finding out, for example, how many people identify as trans. Like, how do we know that? Who is asking that? It's been put on a census question in Canada and the UK. Are the questions well designed? Do people know what they mean? The answer in the UK is absolutely they did not know what it meant. The pattern of answers to whether you're trans turned out that Muslim people who don't speak English are some of the most highly likely to identify as trans, which is just so implausible, and it's so obviously about a language issue. Yeah, so that's just one example. Like, they don't know. Why do they not care about it? I think, if you're detrans, you are the personification of the thing they say isn't possible, which is that you thought you knew yourself, but you didn't. Like, they say everybody knows themselves, everyone has a gender identity, only the person themselves can know their gender identity. A detrans person is someone who is mistaken, and that suggests that anybody could be mistaken. So they're a devastating blow to the heart of the foundation, like absolutely central to the whole way of thinking. And if you allow yourself to entertain doubt on that, you could doubt anything. So they're treated like apostates, actually. They're treated worse than I am, and I'm treated pretty badly. So I'm just a heretic, but they're apostates. And every totalizing religion, and I do regard this as a godless neo-religion, hates apostates more than anyone. And they are shunned. So a lot of things have been very abruptly they've put the brake on it. But of course, kids have been told for the past decade that this is the solution to their distress. Like, I really feel for these kids. Like, imagine you've been sold snake oil and you've been on a waiting list for years. And you think that, when you get that snake oil, all your distress is going to magically vanish and you're going to come out of the ashes like the phoenix rising. And then these nasty, nasty people, these people like me, who are saying that this treatment doesn't work, snatch it away from you. And I don't have an alternative because I can't wave my magic wand and make sure that there's great talk therapy available for all the distressed kids. So these kids are really very distressed now. They think that, they've no alternative. It's very, very upsetting to see a medical scandal in detail play out in real time. Like I've read about medical scandals before, but I never thought to myself, what was it like for the families who sent their daughter for a lobotomy thinking that it was a good treatment, when actually they worked out that lobotomies were human rights abuse and it destroyed people's minds? Like, how must they have felt for the rest of their lives? But those are the questions that we now need to ask about the people who've been mistreated in the Tavistock and elsewhere, because the Tavistock is not unusual. The only thing that's unusual here is the scrutiny, I have to tell you. I'm sure your clinics are no better.
Well, that's concerning. Now, we've already started to finally triggered a proper high-quality review. And what do you think its the most important findings?
Basically, there is no evidence that puberty blockers help with gender distress in children. There's very little evidence for the use of cross-sex hormones in general. It's obviously true that puberty blockers, which just basically do what they sound like, but they're basically a chemical kosh. It's like going directly into menopause in one day. They just cut off a particular whole set of hormonal interactions in the brain and body. We know that that's going to be bad for you, because it's interrupting an extremely important developmental sprint. It can't be good for you to do that. The question is, how long-term bad is it for you? And the emerging evidence is it is quite long-term bad for you. Your brain and your bones won't recover really. So that's clear. It's also clear that if you progress from taking puberty blockers early in puberty to take cross-sex hormones, you'll be sterile. You probably won't be able to have an orgasm, and you may never discover what your sexuality is because you won't ever have gone through your natural puberty that tells you who you are as an adult. So all of those things are known. But what Cass said was that the evidence for using it to treat gender distress was neither one way or the other. But if you think of the bad things on one side, like the sterility, disrupting a very important developmental moment, you need something very big on the other side to justify it. You need that it really does treat this really horrific feeling very, very well. And that's gone. So now there's no justification for using puberty blockers. There really isn't. There's no promise that it's going to help, no likelihood that it's going to help, and it's very, very risky. So that's the big one, I think. And then just the total, really very poor quality of both the care and the research. And what came out at the end was there's just no evidence base for this treatment pathway. They've been doing it since 2006 or 7 in America, and in quite large numbers globally since. And they've been doing it, full throttle in the Tavistock since 2014, and they've no evidence for it. And just a priori, you would know that interrupting a child's puberty would be a very significant thing to do. And sterilising somebody, sterilising a child, you say to yourself, well, they could come off the puberty blockers and go through their normal puberty, not sterilising them. But basically nobody does. About 98% of people who go on puberty blockers go on to cross-sex hormones. And then you think, well, they don't have to go on to have the surgery, they could still revert. But at some point, you can't go through your own puberty anymore. We don't exactly know when, but we know there's a window and it closes. So they are sterilising people, and they're sterilising people at age 10 or 11 when they start them on the puberty blockers with fairly high certainty. And you would only do that, the only situation I can think of that you would do that in is if the child has a cancer that's going to kill them, and you refer them for radiotherapy or chemotherapy, knowing it will sterilise them, but it will save their life. So they're doing a treatment pathway that a thing on the other side of the scales would have to be death. And that is why they say the suicide risk is so high. Gender distress does not need puberty blockers to stop suicide. Puberty blockers are an ineffective treatment, a non-effective treatment for suicidality in gender distressed kids. That wasn't the evidence is not in yet. That was the evidence is in, and that's a lie. And it's a lie that the campaigners say all the time. And the reason they say it is because they know they need something really big on this side of the scales when people start looking at what's on this side of the scales.
When we're constantly told that to not affirm children in their condition is to risk that they'll take their own lives, it's pretty amazing to discover there is precisely no evidence of increased suicide risk at all.
There is strong evidence that it doesn't. That hypothesis can now be discarded.
Yeah.
So children who are gender distressed are, sadly, more suicidal and a bit more likely to kill themselves. But the two things you need to know are, one, it's really not a high risk. It's tiny numbers, but of course every child suicide is a horrendous tragedy. But two, these children have many other sources of distress. A child who's seen at a gender clinic very commonly has some or all of, like a large number of, eating disorder, childhood sex abuse, family trauma, autistic spectrum disorder, cutting, depression, anxiety, OCD, all these conditions. Like, children commonly have several of them. And these are known as comorbidities. So when you compare the children in gender clinics with children who have similar other mental distress, all that excess vanishes. All the excess suicidality, which again is not very high. So it's the most disgusting bit of moral blackmail I've ever seen in my life on any subject, is to tell parents you must do this thing or else your child will kill themselves. I mean, I'm angry about many things in this, and I haven't allowed myself to feel the anger since I discovered this topic, which was about 2018. Because I can't get up every day and feel this angry when there's work to be done, and have to focus on the work and the future and be willing to accept people changing their minds when I'm angry with them for ever having got it wrong in the first place. But since the Cass review came out last week, I have been so angry because I've allowed myself to feel the anger, like the sheer viciousness of telling parents and teachers, if you don't affirm a lie in this child, the child will kill themselves, when there was no evidence for that, when it was false. It's downright wicked is what it is.
And at the same time, probably neither the parents nor the children had the risk of sterility explained to them.
I mean, we know that came out in the Kira Bell hearing. So at the first hearing, they called the endocrinologist who headed the service where they would refer the children for their puberty blockers, and the lawyer who was representing that endocrinologist was asked what were the youngest kids they had prescribed puberty blockers to, and they're given puberty blockers to 3 10-year-old girls. And at 10, that's definitely early enough that if the child starts puberty blockers and then goes straight on to testosterone, that child will be sterile. Absolutely, definitely sterile. No possibility of, I'm not talking about infertility. I was infertile. I went to a fertility clinic and had children by IVF with my husband. This is sterility. There is no fertility to save because your gonads, your testicles or your ovaries, they mature in puberty. That's when they become capable of producing, the things that turn into babies. So these girls, if they go on that pathway, they will be sterile, no doubt. And also testosterone is very bad for a woman's reproductive organs. It's very bad for her uterus and her vagina. It thins the walls of them, causes pain, bleeding, and atrophy. So these girls are being put on a pathway that means they're going to have a hysterectomy young, like before they're 20. And the endocrinologist was asked, were they counselled about this? And you ask yourself, how could you possibly explain any of this to a 10-year-old? 10-year-olds tend to say stupid things like, oh, I don't want to be a mother anyway, but anyway, if I change my mind, I'll just adopt. How many 10-year-olds know what it's like to adopt? We looked into adoption. This is not an easy path, and you don't do it for you do it for the child. So they didn't. And the excuse they gave was that it was possible that the girls could come off the puberty blockers at age 14 for 6 months or so, allow their ovaries to mature enough that they could go through a cycle or two of IVF and collect and freeze the eggs. I mean, again, I've done fertility treatment. This is just, it's a fiction. It's a dystopian fiction. Nobody is going to do that. It's a miserable experience getting eggs harvested. We don't know how many frozen eggs ever thaw and produce babies. But anyway, she's going to have her uterus taken out. Who's going to have the baby for her? The whole thing is just fantasy. Anyway, that was the fantasy that they didn't even bother informing the 10-year-olds about. So that's the level of treatment. But this, I promise you, this is not unusual. This is not that the Tavistock is a rogue clinic. This is happening all over the English-speaking world. I would pretty much guarantee in any or most clinics that are seeing minors, it's that level of superficial, non-informing, pretending that they've informed, pretending that they're not doing something because in the future somebody else might do something different. It's just a scandal, all of it.
The Cass report said that even GPs had testified that they'd been put under pressure to administer puberty blockers because otherwise children would commit suicide. GPs were being pressured.
Everybody was. Everybody. I mean, that lie is everywhere. It's the single thing I hear the most when I try to sort things out for individuals, because people get in touch with me sometimes, is, oh, well, we had to do it because she'd kill herself otherwise. Once people get this central idea wrong, that a girl could really be a boy, it breaks everything. It breaks safeguarding, it breaks logic, it breaks common sense, it breaks medicine, it breaks education, it breaks government, it breaks institutions, and all of them start acting in ways that are antithetical to the way they're supposed to act.
And astonishingly, parents appear from time to time to be co-opted into this.
I won't even speculate as to why they do it, but I'll just point out that they get a lot of kudos for it and a lot of coverage, a lot of praise. Mm-hmm. But that's extreme, and I don't think it's mostly that. I think the problem is, if you're a parent and your child comes to you and says, I'm really a boy or I'm really a girl, you can't sit on the fence for very long. There's a choice to be made, and whichever choice you make, you have to accept some risk of regret in your mind, and you will try to choke that down. So if you decide, looking around, unfortunately you land on the suicide statistics, you go to your GP thinking your GP will help you, but your GP just tells you, I'll refer to the Tavistock, the waiting list is 4 years. You're very much on your own, and there's so much disinformation pumped out by the activist groups in particular that you're quite likely to get the wrong end of the stick. When I tell young women what testosterone does to women's bodies, including women who are on testosterone, they tell me that nobody had told them that. They'd never heard that. So nobody's informing anybody. These parents, suddenly they're in a nightmare. Anyway, so they don't know what to do. They've got no support. They've got a load of misinformation, and they have to make a call. Like, they really have to. And if they decide what I would say to them, which is, no medical interventions, do not go near any medical professional on the subject of gender, because they will put you down the pathway that we now know is not helpful. You're very isolated. Your friends are telling you you're a bigot. They think that it's gay 2.0. They think that you're like a homophobic parent in the 1980s. Nobody is supporting you. Your child hates you. You're terrified about the suicide risk. And, you may hold the line, but you may not. And if you don't, you have made a choice that you can never unmake, and you must now think that you made the right choice. So those parents become the most dedicated to the whole narrative, and they're the people who will never ever change their mind, no matter what, because it's in the past for them. They can't undo it. So those parents are not reading the Cass review with an open mind and thinking to themselves, that's interesting. So when Lydia came to me and told me she was really a boy, and I said yes and got her private puberty blockers and hormones because the NHS waiting lists are too long, and she had the mastectomy a year ago, and I've been calling her a boy for the past 5 years, there was no evidence for any of that. It didn't make her feel any better. Oh, how interesting. They're thinking Dr. Cass is a transphobe and a bigot, and, she used bad research, and she ignored all the activists, and she listened to transphobic bigots like Helen Joyce, or whoever, because that's what they've got to believe to live with themselves. So those people are just going to be a massive roadblock to us getting a well-structured and supportive medical treatment for distressed children going forward, because they need it to be true what they did. I'm so glad I was never in that situation. My heart goes out to them.
Yeah, well, I must say, mine does too. That is an awful contemplation. Because all parents want to, vast majority.
Nearly all parents want to do the right thing.
In your book, Trans, you talk of institutional capture by trans activists funded by billionaires.
Helen Joyce is the author of Trans, When Ideology Meets Reality. Thank you so much for watching, liking, and subscribing. And as always, the link to the original source video can be found in the description.